before I start with my 10-year journey, there's a reality. My story was so different, and I, for years, heard from other patients, all I ever wanted was what you got. And it was unique, and it was only unique. I'm a dime a dozen, and I don't mean that disrespectfully, but things happen in healthcare all the time, and we know that. Number one, I'm lucky to be alive. I get that. But more importantly, I had a physician that went around the system and reached out his hand when it wasn't fashionable to do so. He had a relationship with me long before the institution even knew that he was talking to me. And I would not be standing here today if it wasn't for that. So I'd like Rick Van Pelt to please stand. Over the past 10 years, there's been times that we want to kill each other, It's gotten like that. But you know what? Every time I see this man, if we haven't seen each other for a year or two, there is a special place in my heart that warms automatically because I think I was so lucky to get that communication, to get that apology, and to get that willingness to just have a conversation. And he was also willing to have me ask, are you okay? And then later admit that it was the first time somebody had asked him that. And that can't happen. So, the video clips gave some great, the one Erin did, which Erin, you did a great job on that presentation at the beginning of the dinner, gave some roadmaps. But let me tell you, our first dinner was at my husband's restaurant, okay? And he did it for cost. Prime rib. It was probably the best dinner we've ever had food-wise. And it was at cost. And we had 75 friends and family. This was a fundraiser so we could make big money and then we could, take on the healthcare. Well, 75 friends and family came. There was one person from the healthcare community, which we now know was Rick Van Pelt. Poor Rick. But he did it. What courage, huh? To meet my clan and be there. And I remember thinking, I had to pay my husband. I'm like, can't you just give us the food for free? Come on. We only made $7,000. So basically, we netted $5,000, and we got brochures. I remember those were the little things that I got excited about, And then, because I was going to take these brochures to the hospital and say, hey, hospital, you got to give these out to all the patients and families. I was so clueless. And most of you who know me remember that. And it was a journey. And I quickly learned that the other thing is I was able to meet, let me back up a bit. I was able to meet people that had been on my code team, my orthopedic surgeon, many people who were affected by my event. I got to see tears. I got to see people who, virtual strangers, come up to me and start crying. My God, we prayed for you that day. I got to see a health side of healthcare that I believe most patients and families don't have the opportunity to. And obviously, we're on a journey to change that. Because that's what made me realize that my event did matter, that I mattered, because that's not the actions I was seeing prior to that. And that's my goal, is for every patient and family member to have that when something goes wrong, regardless of why. But, the brochures, if I had an inkling of how hard this journey would have been, I would have turned around. And Winnie and most of my friends can attest to that, even my family members. We need to give a round of applause to my poor children who have lived with MITSS for the past 10 years. And my husband, who had to go home because we have a dog, and it's like a kid. But he was here all afternoon helping, and they've been schlepping. He couldn't wait till MITSS actually made some money to pay for our own brochures, because he was putting up all the funds and everything. He has no idea how many cups of coffee, how many lunches he paid for, but he's not here, so I can say that. at the beginning. You know, I met with everybody. If somebody said there was somebody passionate, I went. I picked up the phone. I talked to virtual strangers. I got to actually meet a side of Linda that I forgot existed because, you know, when you become a mother or a father, suddenly the brain just, I don't know what happens to it, but it just turns to mush. And I've always been passionate about people, and I care about people, and I feel people's pain, so it was an easy stretch for me to go here. It was almost like I was waiting to figure out what I was going to do when my kids grew up, and it found me. So for me, I believe it all happened for a reason. It was me and it was Rick, because that's the way it needed to be for this to transpire. You know, we had a second dinner. And we thought we'd go to a hotel, you know, because now we're big. Well, we had another 75 people. Rick was, again, the only person from healthcare. We even had a speaker, but we had people pay more money, and that was okay. But then I have to say there's another person in the room that means a tremendous amount to me, and it's Jim Conway. I went to him, yep. I went to him and asked him to be a co-chair, and he actually coached us on how to do some of these things, you know, spreadsheet, who do you need at the table? You know, he was really guided us through this process, and then we had 150 people, and we actually made $50,000, you know? Of course, it cost us a lot more but you know, we were still making money. It was better. And then from there, he just invited people who are still, you know, some are still on our leadership committee. It's been a journey, but so as far as dinners, that's how it's changed. But I can tell you, the moments for me that are most special is when we had our first patient and family group in 2003. I was a quasi-member, and I remember sitting in that group and participating as a patient, and just being filled with such gratitude, because this is all I ever wanted, was somebody to listen, to validate what I was going through, and to support me. And here, I was able to be part of an organization that was doing that for somebody else. I remember when Rick and I first took the national stage at the National Patient Safety Foundation in 2004. There were some people that were a little afraid about what we were going to talk about. I remember it had to be Jim to say, let the story get out there. You know, he was the brave one. But people were afraid, you know, a doctor and a patient, Jesus, you know, this might not be good. And right before we actually spoke that day, I got another message that we started our second patient and family group, and I was thrilled. So that's how it evolved. We had one clinician that started out, and then we have Dr. Susan Lafarge that I can't thank enough, because she's really expanded the curriculum for the patient and family group, and Erin, who's helped, who's been a wonder too. So I want to thank you, Susan and Erin. And that curriculum's up and ready. We've got to, just like we've created the need with all the people that are like-minded for the clinician support, we have to do the same thing for the patient. We're telling them the truth now. We might be, you know, but we still need to do work on the patient's side. And MITSS would like to help you to do that. We have the most data anywhere. So invite us in, you know, we can pick Susan's brain anytime, right, Dr. Lafarge? Say she should have. So let me talk about some other things. We've held some forums. In 2004, I remember I wanted to do this big thing. I wanted to have all these people together we wanted to see about clinician support. Jim Conway sponsored it at the Dana-Farber. I think it was his staff that came, some of his risk management from the Brigham, John Fromson, who was then at the Mass Medical Society, or Physicians Health, and then we had a psychiatrist that treated physicians, and then somebody else, but mostly we had people from my code team. The physicians from my code team were the only people we could get to show up that day. But we had a discussion. It was clear, it was pretty clear at that point we were not ready. And I remember on the journey, Rick and I would speak, and people would come up to us and pat us on the shoulder and say, thanks, this is really good. Keep it up, let us know how it goes, but get the hell away from me, you know, one of those. And then a few more times we'd hear, you know, we need to do a better job. And now you heard it, if you came to the afternoon forum, you heard it. They want to know how to train people because the time has come. We have to do something about these clinicians. So my hope is that when we start recognizing that the clinicians are hurting like this, we will start to think about how to emotionally support the patients and families in a different way. We're getting there. So, we went from that in 2004 to 2009 hosting. We were lucky enough to have CRICO. I'm going to say, it used to be Pro Mutual. What's your new name? Coveries, okay. Coveries and Mass Medical Society sponsored this event, and we had 80 people in the room. It was people that were like-minded and passionate, but unfortunately people that weren't really able to make change in their institution yet. Today, we had a forum, and we had teams of people. We had physicians, we had nurses, we had risk managers, we had EAP services. People are hungry for this. So I've seen the shift happen tremendous amount. Lucian's work and Jim's work with IHI with the reacting, what is it, Jim? The responding to critical incidents, that paper has really catapulted this, so hasn't Lucian's work, and another CRICO-sponsored thing when things go wrong. CRICO made a couple of videos, one from the patient's voice, which was an excellent video that they invited us to a conference a few years ago that they did with Kaiser on both sides, and we were able to invite patient advocates to this conference. They saw the video for the first time, and the whole table was crying because they were hearing exactly what they've been saying, but nobody was listening. So they hit the mark there. And then they've just done another film called Healing the Healer, which, again, I play at places, and mostly people want to just tell me about how bad they hurt and how they all have a story. So whether you're a patient, a family member, or a clinician, we all have stories. We have family members that have stories. We have neighbors that have stories. We're all affected by this, and we need to do a job. And then we were able to, sometimes my naiveness really pays off, but I think, we're seeing patients, we're getting calls, but we don't have many, ethnic background people. We don't have Black, Latino, why is that? So we decided with New England Black Regional Nurses Association, I don't know, there's so many associations, but with them and a few other people, we did a program a couple of years ago on a Saturday afternoon in August at the Reggie Lewis Center in Roxbury, and we had about 80 people take a day off it and come. And it was a wonderful, so we thought we were going to get some solutions by having speakers and then doing roundtables and find out what the needs were. Well, what we did was leave that forum with more questions. That's a big nut, and I don't know where we can focus. So we're working on that, just to let you know. So just little things. Every time we get a new person on our leadership committee, people that wouldn't even be in the same room with us are now embracing us. So those changes are unbelievable. And I know it's due to all the people I mentioned before. This dinner is because of the planning committee. So everybody says congratulations to me, and I know it's because we have people that work 11 months out of the year to make this a success. So I want to take time right now to thank the planning committee. So if you could stand up, please. Joanne, Stacy. They really do hard work, and they meet, and I do mean they meet. They hold Winnie and I to task, even when we don't want them to, right, Winnie? It's been a wonderful group of people, and it's funny, every time I want to throw in the towel because it gets a little hard, or just one more wall I maybe don't want to climb over, I pick up the phone, and it's someone needing support. Doesn't matter what side they are on healthcare, and it's in those moments that I remember, I got to keep doing this.